So, Jamie, welcome to the programme. How much of a problem is Omicron for hospitals right now?
Yeah, afternoon, Nana. It's all pretty positive news, to be frank. Remember now, in the middle of December, we had the Omicron wave started kicking off. There were people coming out of South Africa saying it's a mild variant, and it's kind of turned out to be the case. And the SAGE modelling is frankly proven to be absolutely pointless again if you look at the data. So where we currently are, cases are coming down. They're still relatively high, but we have had significant numbers of tests. If we look at the hospital situation, I suppose the more important figures now to focus on, Nana, are kind of patients in kind of the ventilated beds, because we've had some numbers from NHS England saying that nearly half of the patients actually in hospital at the moment with COVID are primarily in for other reasons, and that's gone up now because of the spread of Omicron. So the cases have been coming down across the country. Patients in hospital has been coming down across the country. Patients in ventilated beds has been coming down across the country. So that's England, Wales, Scotland, Northern Ireland as well. And the figures that SAGE were predicting, if Boris, for example, in England didn't introduce kind of further measures beyond Plan B, which he didn't, they were estimating potentially up to 3,000 deaths a day. Well, we're currently running at around somewhere between 200 to 300 if you look at the deaths within 28 days of positive test. But remember, those are anybody who dies of any cause within 28 days of a positive test. Is probably closer to 100 when you start factoring the death certificates and how many people actually dying of COVID.
So it's about 100. And in your world of statistics, is that a high number of people dying of something that we should be continually tracking in this way?
Well, we get kind of thousands and thousands of deaths every week. It's about 5-6% of the deaths are COVID. Some people would say that's too high. Some people would argue and say, well, why are we focusing only on kind of these deaths when we know that we're seeing excess deaths across the country? You obviously got your debate on the show today talking about NHS staff and mandates. It's quite clear that if you get rid of a load of NHS staff when you've got these significant waiting times, you're probably going to end up causing more deaths than what you would save. And just looking at the Omicron variant, Nana, it's quite clearly spreading across the country, even in the vaccinated and in the unvaccinated as well. And just looking at the facts and figures now, if you look at the flu vaccine, where people obviously sadly die of the flu, not so much now because there's less flu circulating, and you look at the latest figures on that, there's significant numbers of staff who haven't had the flu vaccine in the NHS in England who are working with frontline patients, but there's never been any call whatsoever kind of sack them if they don't have the flu vaccine. So I think Omicron's changed the game with regards to all of this. It's really positive news on the data side. I think, as Boris is obviously talking about easing lots of restrictions, the Devolves are a little bit behind. I think Northern Ireland are catching up a little bit. It's all pretty positive at the moment on the COVID front.
What is the death rate for Omicron?
So, well, it's difficult to link it direct to Omicron until we start seeing the ONS data start coming through in the next few weeks, because when the difficulty with the data we get each day on deaths within 28 days of a positive test, the problem with those figures, as I said, is that we've had 3.8 million people who've tested positive for COVID over the last kind of 28 days. And then sadly, some of those will die of many different causes. So the ONS figures are going to be the critical ones. And the critical thing to really focus on is, whilst we've seen this massive, massive rise in cases, we've not seen that massive, massive rise in deaths. So it's quite clear that Omicron is far less deadly, and it could be the game changer in the pandemic. It's kind of showing similar trends to what we've seen 100 years ago with the Spanish flu, new variants, more transmissible, less deadly. And then obviously what the flu vaccine's done over the last since they've developed them is they modify those for different variants. I'd imagine now that's where we probably need to end up with Omicron and future variants of COVID, is kind of managing as part of our annual wave. I think the more important thing, Nana, going forward is going to be the NHS struggled to cope before the pandemic. We need to really have a serious conversation and think about what does the NHS need to do so that it's not overrun next year, so we don't start thinking of restrictions, because obviously COVID is not going to go away.
I was just going to ask, what would be the risk? So we're seeing, you said 5 to 6% of the deaths currently are due to COVID or Omicron. And what would be the risk to people's health if the 73,000 people working for the NHS who haven't been vaccinated if they were fired, surely that would put immense strain on services, and then people would die from being unable to access healthcare. Do you know if there's any sort of objective number on that?
No, I don't think anybody's probably put the number together. Remember, though, this NHS mandate is only in England. For example, where I live in Wales, they're not planning on putting people out of work if they don't have the vaccine. And a big problem we've also got with hospitals at the moment is there's a load of patients in hospital who can't be discharged because they sacked all the care workers because they didn't have the vaccine. So you do need this really big joined-up system, and these kind of threats, if you don't have a vaccine, you're going to lose your job, clearly isn't putting public health first when you start looking at kind of where we are now in terms of the Omicron variant. But you bang on the money there in that if we've got huge waiting lists, sadly now, regardless of if anybody loses their job or not, even if the government backtracks, it's quite clear that many people are going to die over the next 5 years because they've missed diagnosis and missed healthcare over the last 20 months. And the government would say, well, we've had this pandemic and it's been unprecedented times. But if you're going to try and tackle that backlog, getting rid of staff when it's quite clear that the variant's going to spread regardless of if these kind of workers have the vaccine, just doesn't make any sense.
Do you think the government could be bluffing and just trying to force, some more reluctant people to get vaccinated, and they're not actually going to go through with the firings in April?
Well, I think that in part was why we had the vaccine kind of passes policy and threats of having the vaccine passes policy, then bringing them in. But when you actually look at the vaccine stats, very few people who chose not to have the vaccine, and when they brought passes in when you had to go into some venues, you didn't see a massive uptake in vaccines. So there's been numbers of coercive tactics that have been used by the government to try and get a vaccine uptake. Remember, the vast majority of people have had a vaccine in the country, but I've had two myself, but the vast majority have had it. But when they've tried to have different policies to try and force people to do it, it hasn't really moved the dial at all. So I think this one's probably backfired again on them, and I would imagine maybe the government will turn around and say that the kind of the situation's changed because of Omicron, because obviously the government's probably not going to want to back down and say it's on a U-turn, but they could probably come back and say, well, we're removing this mandate because the situation's changed because of the new variant being more transmissible.
Hi, Jamie. Calvin here. I want to bring it back to the stats since that's your area of expertise. People are quite rightly afraid because we're not used to being obsessed with death numbers in this country. We're not used to seeing the statistics on a regular basis. So I want to put some perspective into place here. These people that are dying with COVID or because of COVID, not within the 28 days, people who are dying genuinely because of COVID, how does that relate to people who are dying from influenza and or other respiratory diseases?
Yeah, so Calvin, we are seeing more people when you look at the death certificate, I think over the last 20 or so months, it's been more common to put COVID on the death certificate. It's been covered a lot. And when you start looking at it, we are seeing more deaths. And if you take the last kind of 20 months, we've seen clearly far more deaths from COVID than you would normally see from influenza. But to the summer months, when COVID obviously was quite kind of limited in terms of the spread, we were seeing more deaths from influenza and pneumonia because the ONS put those together than what we were seeing from COVID. Now, I think the problem we do have now is the main focus is on the daily figures, not the ONS figures, which is what the BBC and ITV and Sky News will put out over the airwaves, saying how many people have died and reported in the last 28 days. And those are clearly deaths that are within 28 days of a positive test, which is highly misleading now, especially when the vast majority of patients in hospital, significant numbers, are going in with COVID, but not for it. So, we've seen significant numbers of excess deaths over the last few years. But I think the more worrying, Calvin, is the last 6 months, we have been starting to see more deaths that are above average, that are non-COVID related. And this, you don't see this talked by Chris Whitty at the press briefings and all these kind of deaths. So, we've got to stop the obsession with just COVID, and start thinking about all these other people who've sadly losing their lives because of the missed healthcare and all that kind of stuff.
I think, Jamie, perhaps we need to stop doing statistics. I mean, we're sick of them. I'm sick and tired of hearing numbers of people who've died. Thank you so much, Jamie. Jamie Jenkins. He's